Hey everybody, this is Kevin. Hope everyone had a wonderful Valentine's Day. I'm going to see if I can play our promo video here real quick and then jump right back in. It's just me today. We'll have a little bit of fun on Perfecting Peds Show. All right. Okay. So today, Jenna is out. She's got a lot of other things going on this week, and hopefully, we'll see her in just a little bit. But we are going to cover something that I think is really interesting and something we've already experienced to a certain degree. Some statistics show that we did not actually take our kids to see their pediatricians or to see their physicians as often, during the pandemic. But things are changing a little bit now. Now we're getting a little bit more open. Still, the difficulty is getting our children or anyone for that matter in to see a primary care provider or a specialist for that matter. And so, I wanted to cover a little bit about some articles and some recent studies and things in the world of children's medicine that really go into what's happening in telemedicine and how that can be really helpful to be able to take care of our kids. So I'll flip over the screen so we can just do a little presenting here, little show and tell. And if I show my entire screen here, I'll just share it like this. Perfect. Okay, so this was a really interesting little review here out of California. Telemedicine reduces hospital transfers for very ill kids at rural community emergency departments. Okay, so this is something near and dear to my heart, being a rural medicine guy. So in the rural medicine settings I was in, oftentimes we would have a telestroke doc that would be able to jump on board so that we could help those individuals acutely and then make a decision on what needed to happen next. And as we're in the Perfecting Peds show, you can hear my little guy in the other room. But what needs to happen next with those stroke patients? And then sometimes we had other opportunities to work with tele-oncology. So if we had I remember there was one facility I worked with, and in tele-oncology, what I did is sent a nurse over for training inside of this rural setting. The nurse got training from an oncology partner. And now when the oncology visit was happening, when the labs were necessary, all of those other pieces that make it very inconvenient for an individual to travel, we had a remote site that was set up at our hospital that qualified for those individuals to have telehealth visits. This doesn't sound like all that innovative, but interestingly, back in 2014, it was. These were things that people just weren't doing yet, and so now seeing that expand is fantastic. The one thing that we might not have seen as often is it's just really easy in a lot of these care settings to say we've got a kid that comes into a facility and we do not have an expert in that space. So what we're going to do is just transfer them out. What it does is it causes a huge level of inconvenience for the family. Not only are they having to change their schedules, potentially their job schedules, find lodging for them and the rest of their family to be able to be there with their kids, because with children, oftentimes we do have higher levels of family involvement, that they're staying with this individual in the facility and not leaving the child by themselves. So that adds a ton of burden. So what they did over at this hospital system, these rural hospitals in Northern California, is they had televisits with pediatric emergency docs. And thankfully, the results of that were a significant reduction in the number of individuals that needed to be transferred out to the larger area hospital that had pediatric specialization. So I love that. And I thought, hey, great. If we can find ways to make it easier to keep our kids closer to home, using telemedicine successfully and safely, by having an expert to triage, wonderful. Some people may wonder, does that really give you the full benefit? Having a child in a rural area where there aren't necessarily the specialists there that were going to be able to take care of them, and having a televisit, something that is over video or audio. And technology has improved massively. When I was at a few hospitals, things that we were already starting to utilize, were trackers for rashes or other skin conditions that we could, look at bordering. With a cell phone picture, we could look at a border. We could look at the level of redness. We could look at other discolorations in wound healing. All of those things could be done, basically virtually, even at that time. Which is funny. I'm saying even at that time, it really wasn't that long ago, Kevin. You're not that old, right? But I think regardless, those things were happening, and now they've advanced even further. So I wanted to switch over to another quick little document for you guys to see. It's some of the, suggested things that can be done via telehealth for pediatrics. Granted, we're kind of switching gears here. Instead of an emergency medicine, we're talking family medicine here. But the list is, fairly considerable, and what is inside of that list with acne and chicken pox and going down to diaper rash and, mild fevers, pink eye, rashes, sore throat, and then some follow-up visits that are important to be able to recognize too for asthma, diabetes, epilepsy, and last one is mental health, which we'll go into a little bit deeper in just a second. But all of those things, are currently available for us to be able to do over a telecommunication platform. And I think we've talked before about just the sheer convenience. In fact, it was Kristen and I, the other day talking about point of care testing. And we were talking about the sheer convenience of just being able to go to a local area like your pharmacy that is offering point of care testing and have your child get a test if it's for RSV, strep, flu, COVID, etc. So that convenience is huge. The exact same convenience is noted oftentimes in many articles when it comes to, and even scrolling down to just the benefits listed inside of here. The underserved communities, is one thing that we sometimes can't access it, or we don't have the ability to be able to access or get to a provider, when having the convenience of our own home can happen. There are some issues. We'll go over those in a little bit with telehealth in general in some of these areas when it comes to broadband and other like technology elements, especially in mental health, having privacy. But overall, hey, fantastic. Gives a really convenient location for you to be able to go. The other things that are kind of mentioned in the article, if you do have like special healthcare needs, I think there are some really interesting things about transferring those individuals or moving them when necessary, when we have to do a physical exam or we have other elements of care. Oftentimes the recommendation is not to have this as the first point of care, but as follow-ups or working with specialists. But we can definitely understand if we need to transfer a child, it makes it so much easier to be able to take care of them, in the home situation potentially, and then bring, the medical team to them. The other pieces are going to a doctor's office and sitting there where you're knowing there's a lot of other sick people around you, having your child be ready to sit in a waiting room for a long period of time, very stressful, for a parent to have to go through. And if we're able to be able to bridge that gap with some telehealth components, awesome, really providing some overall benefit. Okay, so the downsides of these things. I think, the main downsides that are mentioned quite often are to do with privacy, because some homes are not equipped for an individual to be able to go in and say, what, I have the ability to be in an area where I can talk about my mental health, right? And I know that I've seen, several studies talking about preparing for mental health telehealth visits, and that being one of the major requirements, that we want to find an area where we truly do have privacy to go into some of the things we need to with our care team. Other things are obviously the ability to communicate, is lessened. So what am I saying by that? Body language. Right now on the screen, for example, I'm a very small individual on the left side of my screen, and all the text is on the right. So if you are sharing documents back and forth with this individual, if you're talking about, a care plan or next steps, or doing things with a diary, there's lots of other, care steps that can be done that you may want to share a visual. Well, now you've pulled away from the ability to see that person entirely. The other thing you can't see are my feet or my legs on this video. And so you can't see if I'm tapping or wiggling underneath of the chair with some kind of nervous energy, or any other body postures that may give you a clue how someone is feeling about what you're talking about, how much they're grasping about what you're talking about, and being able to move forward with it. So there's the other piece. The other element of communication is obviously literally hearing me. I live out in a rural area, so Wi-Fi is not always great. And because of that, sometimes the communication, the clarity for me, I mean, hey, thankfully there's Starlink, so hopefully that's coming to Kevin here soon. But with that, I think that the ability for you to be able to communicate clearly with your providers as you're sitting in the office can sometimes be a struggle, because of the stresses and the pressures. Hopefully when you're in the home area, that is less of a burden, but that doesn't take away from the Wi-Fi issues that could pop up, or the other distractions that could occur in a non-healthcare setting where someone closes the door and the likelihood of someone interrupting you is very, very low. Okay, so there's all of those things to be able to consider overall. there's some really good guides on preparing for a pediatric visit, like a telehealth visit. And one interesting thing that is brought up inside of that, which I really valued, was this. Let me get rid of the screen for us. What I really valued was this. It talked about making sure your child is there. Because sometimes we think, okay, I just need to meet with a doctor, or I just need to meet with a pharmacist, or whoever it may be, and just need to talk about my child's care. But without the medical team being able to see your child and being able to position them in the correct way so they can see your child and see their face, see whatever body part they'd be looking at, all of those things are really essential. And that seems like, okay, Kevin, well, that's easy. It's easy for me to be able to see a child's face. Not always true, because what's the other thing that you're hoping to be able to do when the doctor, nurse is looking at your child or examining your child is hopefully being able to take some notes down, right? Or write something down or notate something in some way that you can take home, for you for the rest of the day or for the rest of the treatment period, whatever it might be. And that's really difficult when you have to hold your child in front of a screen so that they can see. So getting the area prepped so that the child can be seen, you can be seen, you can take notes and be comfortable, and that you can sit there and you can feel comfortable in front of the screen so everything can be viewed and visualized. Another element is I'm looking at my room with the sunshine blaring through, which is actually wonderful. I love the sunshine this time of year. Just makes me feel like, oh, good, spring is on the way. But sometimes poor lighting, can be another difficulty if we're trying to examine something on an individual. So there are some tips related to all the benefits of pediatric care and kind of the advancements that we're seeing in the telehealth space, where and when they can be deployed for you and how they can be convenient, the inconveniences, and how to hopefully prep yourself, a little bit for having a good experience in a telehealth visit. Look forward to seeing you guys next week. Thank you so much for joining. And if you guys want to learn more about pediatrics, follow our PH Ally on all the social platforms that we're on, and also jump into our PH Ally and join the Perfecting Peds channel. Where we have the wonderful Jenna Quinn to be able to tell you everything about what is happening in the pediatrics world, what you need to know to be a better care provider for your pediatric patients, and help you with other clinical consulting elements. So looking forward to seeing you there. Looking forward to seeing you on our PH Ally. Have a wonderful day.